These mutations can feel overwhelming, especially this close to what feels like the end. There's a lot of feelings for all of us right now, thinking like next year I can't do what I'd planned to do, that I'd set aside. So maybe tonight let's set aside the emotions for a moment if we can. Put on our scientist glasses, which is hard to do. Every vaccine so far, all 5 of them, has eliminated coronavirus deaths. That's the good news. There is also no evidence that the variant increases deaths amongst vaccinated people. And both Johnson & Johnson and Novavax have reported some results from South Africa. No one who was vaccinated there died of COVID. Dr. Leo Nissola is a physician and immunotherapy scientist. He's an expert on things like trials. Joining me now from San Francisco, Dr. Nissola, we're now hearing experts talk about this pandemic in terms of years, not months, partly because of the variants, partly because of vaccine rollout. What is the most realistic time frame?
Well, we need people to develop immunity against this virus in order for us to have our life back. In order for us to re-enter society in the way that we are used to, we're going to have at least 70% of the U.S. population vaccinated or immune against this virus. But remember, this is a pandemic, and a pandemic, by definition, it's a global scale event, or it's a global scale health threat. So we have hotspots in the world today that do not allow us to open the borders in the way that we were used to, seeing planes and ships coming and going all the time. So it's very interesting to see how this will play out in the future. It makes me hopeful for the future that the United States is rejoining the WHO, which will be a crucial partner for us in order for us to be able to return life to normal.
The efficacy of these vaccines has been a big concern, Dr. Nissola, and you understand this better than most, and that's why I wanted to ask you about it. A lot of us maybe have a distorted view of the word effective. This caught my attention. David Leonhardt wrote this in the New York Times. He said, quote, of the roughly 75,000 people who have received one of the 5 vaccines in a research trial, not a single person has died from COVID, and only a few people appear to have been hospitalized. None have remained hospitalized 28 days after receiving a shot. To put that in perspective, it helps to think about what COVID has done so far to a representative group of 75,000 American adults. It has killed roughly 150 of them and sent several hundred more to the hospital. The vaccines reduce those numbers to 0 and nearly 0 based on the research trials. So, doctor, it seems we need to maybe reframe that word effective in our minds.
Yeah, I think one key thing that I think it's important, and I always go back to where we were earlier last year. We were living through a pandemic. We were trying to understand if we had enough resources to take care of our people. And we asked these drug makers to develop safe and effective vaccines to prevent us from dying. And that's exactly what they did. So the vaccines that we have today, approved in the United States, and J&J's vaccine that will likely join the market sometime within the next few weeks, gives us that prevention from developing the severe form of the disease. And that's what matters. So when we look at terms like being effective, it's effective in what? And if you look at what is for those studies, those clinical trials, they were trying to prevent people from dying. They were trying to prevent people from developing the severe form of this disease. And that's exactly what effective means in that end.
And will these vaccines continually be improved? Will they be optimized? Because billions in government funds, Dr. Nissola, I'm guessing are not going to always be flowing.
That's right. But we have to understand that viruses replicate. And viruses replicate when they are being transmitted from person to person. We still have community spread of the coronavirus in the country today. So one way of preventing the viruses to mutate and to create new strains is from preventing new infections. So at this time, we are pressure testing this virus by giving some people vaccines, by giving some people convalescent plasma, by giving some people immunotherapy drugs, and by giving people the chance of getting infected with the virus itself. So I do think that in the future, we will see more variants, and perhaps we're going to need to update those mRNA vaccines to perhaps cover them and have a booster shot in some cases.
Dr. Nissola, with us from San Francisco. Thank you, doctor.
Thanks for having me.